Hi friends, myself Dr. Ekta, and today we'll be speaking about stress and how to manage the stress effectively. So first, what is stress? Stress is defined as a person's physical, mental and emotional reaction to a certain stimuli, often known as a stressor. So they can be any kind of stress, like they can be environmental, physiological, a thought that is causing the disturbance. And as we know that if a thought is causing a disturbance and there is a constant running of thoughts which is causing the disturbance, it will lead to anxiety. So we'll talk about the anxiety afterwards, but as we know that the stress is the most like a cause for everything, for every like disorders, which mental disorders which cause, there's a spectrum of mental disorders which are caused by the triggering, by they are being triggered by the stress at the first place. And so they can be these thoughts, they can be this the social factors responsible for it. They can be like the family disturbance which is going on, there's some disturbance with the friends, there are difficulties in the families which is causing the stress at the first place. Now there can be different types of stress. So there's a good type of stress also, that is eustress, and it is a kind of a like which helps in motivating you. It's building a confidence. So that's a good type of stress. Okay, then there's a distress which is causing the pain, which is causing certain somatic symptoms along with it, like the sweating, palpitation, increased heart rate, or digestion problems, muscles become tight because of it. So there can be somatic disturbance, but initially the feeling, the thought of that particular thing, it causes pain. It is causing the pain, it is causing the turmoil in the system, and that is the distress. Okay, so there's eustress, there's distress, then there is an acute type of stress, or there is a chronic type of acute type of stress. Lasts for a very short period of time, whereas a chronic type of stress, it can last for years in a row. And if there is a stress, okay, that is the thought that is leading to that, some constant running of thought is there, some constant thought about certain situation is there, which is like the person is brooding and constantly thinking about that. It will lead to anxiety disorders in future. And there are also various anxiety disorders. There is this phobia, there is this GADs, there are generalized anxiety disorders, which remains persistent for around 6 months to 1 year. So yeah, so the stress is the primary thing which is leading to all sorts of spectrum of mental disorders. Okay, so we should be effectively managing the stress at the first place, so that it doesn't cause these disorders in the future. If we effectively manage, if we through lifestyle, through medicines, through targeting your physical health as well in diet, so these things can be managed effectively, and it will not cause a disturbance in terms of like physical aspect or in terms of mental aspect in the future. So because there are so many, you have heard about psychosomatic disorders, somatopsychic disorders. So there is psychosomatic, meaning psyche, that is the mind, which is affecting the soma, means body. So the disturbance always starts with the mind, with the mental disturbance. Okay, it can be like your reaction towards this kind of a psyche, or this kind of a disturbance in the mind can lead to various physical disorders. Okay, and it depends on person to person's reaction towards that stress. It can be increase in heart rate, increase in BP, increase in like there can be digestion problems, there can be certain other issues, there can be like development of any hormonal disturbance later on. So it varies from person to person how a person develops a disease in the future, But initially, in psychosomatic disorders, all starts with the mind. Appetite disturbance in the functioning of the liver. It affects the metabolism of cortisol as well. Cortisol is produced normally by your system, but it is not being eliminated by the liver properly. It is not being excreted or metabolized by the liver properly. So due to which the state comes where the cortisol is high in your body, okay, but the production is normal, or you can say in the optimum range, but because it is not being excreted or eliminated by the liver, not being properly metabolized by the liver, it is increasing in your bloodstream, and that is causing the hypercortisolism. And again, if there is a problem in the metabolism where you have a condition called as hyperthyroidism, okay, in which the metabolism increases, okay, there is a hyperthyroid condition, that means your metabolism is very fast, and due to which the cortisol removes very quickly in your body, despite its normal production from the adrenal cortex. So it's normally being produced, but due to hyperthyroidism, the metabolism is very fast, so it is getting metabolized very quickly, and therefore when you see the count in the bloodstream, that will be very low, okay, in the blood. So that condition is known as hypocortisolism. So there is a type of this gut metabolism also which gets affected by taking constant stress. And why it happens? Because there's a microbiome which is there in the gut system. There is this balance of the bacteria, parasites, fungi in the gut, which helps in metabolism and digestion of food. Now, what happens when you are in constant state of worry or stress? This balance get disturbed, and one type of good bacteria, if it is getting reduced or eliminated by the system, then the unnecessary growth of the other type of microbiome occurs, and it causes that imbalance in the gut, which is also known as dysbiosis, and it happens due to the this production of one type of microbiome which is getting reduced or eliminated by the system, and which is leading to unnecessary growth of the other type of microbiome in the gut, and that is all disturbing the metabolism in the gut and leading to various disturbances in the body, and that too hyperacidity. There can be then this hyperacidity issues if it is like really staying for a longer period of time, can lead to the ulcer formation in the stomach. So it needs what all disturbances which are causing the problems at the first place is basically the stress, which needs to be tackled. So basically you need to replace the heightening factors with the dampening factors, which will help in reducing the stress. Like if there is a negative thought which is building up and it's causing the problem, you have to replace it with a positive thought. And there is a co-rumination. You need to practice together these positive mindfulness with that person itself. And again, there is this creating a supportive environment with that. And if there is problem with ruminating in the whole in you and your family member as well, so you have to stop building up your thoughts like that, and which will cause the problem. You have to effectively control it and regulate it, reduce it when required. If it is required for you to work, that minimal stress is also necessary, but that should be in your control and regulation. If you are regulating your stress effectively, then that is not going to cause any issues. But if you are not, if it is not in your control and it is uncontrolled, it will go further, and it is going to cause the mental disturbance, as I have talked about, that it will lead to various anxiety disorders and various somatic disturbance in the body. Now, how like the stress is causing the effects in your body, that is given in the chart below. So in seconds, minutes and hours of taking stress, your sympathetic adrenal medullary system, that is the response which I talked about earlier, that adrenal system, uh, that is causing the increase of these hormones like adrenaline and cortisol. And again, there is this hypothalamo pituitary system, that is an axis which is causing the production of the cortisol, which is going to increase a lot during the stressful period. And again, there is a pro-inflammatory signaling which happens in 60 to 90 minutes after the stress onset. So it happens in hours, minutes or seconds. Now if it is continuous for days, weeks and months, so it causes a dysregulation in the biological rhythms. And there is a now there is a cellular insensitivity which develops to cortisol. Now the cell is becoming insensitive to the production of the cortisol, which happens in days, weeks and months. Plus why it is actually happening? Because it has been like constantly you are being under the stressful state for a long period of time, which is causing now adrenal fatigue. Now it is not either it is not producing enough cortisol, or if even if it is produced, your cell is becoming insensitive towards cortisol. Okay, and these are the responses of your body. This state is being there for so many years. It is going to cause the metabolic dysregulation, obesity, see cardiovascular diseases, atherosclerosis, and accelerated aging, and increased risk of early mortality and frailty. So basically, stress in a long term will go towards the systemic disturbance. If it is like so, it needs to be managed well through like number one is the breathing exercise. So you can just try the breathing exercise by holding your breath for a few seconds and then releasing it. So that can be done. And for whenever you are in the stressful period. The second thing is meditation, counseling, supportive environment. The most important thing in all is developing a habit to reduce and manage and regulate the stress. That is very important. And when you do that, you can do that with meditation, you can do that with counseling, or you can do that with introspection, by replacing your thoughts with positivity if they are negative, and if they are disturbing you,